Welcome back. We are on Chapter 11, the scene size up. The topics we're going to discuss is sizing up the scene. In this first section, we're going to talk about scene size up. The elements of the scene size up. First, checking the scene safety. Taking standard precautions. Noting the mechanism of injury or nature of the patient's illness. Determining the number of patients and deciding what additional resources may be necessary. Scene safety. The only predictable thing about emergencies is that they are often unpredictable and can pose many dangers. As you near the collision scene, you want to look and listen for other emergency units approaching. Look for signs of a collision-related power outage. Observe for traffic flow and look for smoke in the direction of the collision. When you are within the site of the scene, you want to look for clues indicating the escape hazardous material. Look for collision victims on or near the road. Look for smoke not seen at a distance. And look for broken utility poles or downed wires. When within sight of the scene, you also want to be alert for the persons walking along the side of the road toward the collision. And watch for signals of police officers and other emergency service personnel. As you reach the scene, you want to follow instructions of the person in charge. Don appropriate protective apparel, including head protection, a bunker coat, and the ANSI-approved reflective vest over your coat. And sniff for odors that may indicate a hazardous material release. Establishing the danger zone. Around the wreckage of every vehicle collision is a danger zone. Specific guidelines for establishing zones. So when there are no apparent hazards, at least 50 feet in all directions. When fuel has been spilled, 100 feet in all directions from the wreckage and the fuel. Specific guidelines. When a vehicle is on fire, at least 100 feet in all directions. When wires are downed, you want to be one full span of wires away from the poles to which broken wires are attached. When hazardous material is involved, you want to check the Emergency Response Guidebook or the ERG. Crime scenes and act of violence. Evaluate for the threat of violence. Fighting or loud noises. Weapons visible or in use. Signs of alcohol or other drug use. An unusual silence or knowledge of prior violence at that residence. Here is something to think about. Although any call can present as a potential safety hazard, what types of calls might pose the highest threats of potential violence? Standard precautions are going to be your body substance isolation or BSI, and always have personal protective equipment available, which is PPE. Nature of the call. Determining why EMS has been called in the first place. Is it due to the mechanism of injury or the nature of illness that your patient is presenting with? And remember, just because it is an injury accident, it could have been a medical problem before it was a trauma. Mechanism of injury. A force or forces that may have caused an injury. Understanding the forces can predict injury patterns, and it can be very useful in predicting injuries associated with certain types of motor vehicle crashes. Here's clues such as exterior damage that may lead you to suspect certain types of injuries. Head-on collisions. These have great potential for injury to all parts of the body. Two types of injury patterns are likely, the up and over pattern and the down and under pattern. The first pattern, the patient follows a pathway up and over the steering wheel, commonly striking the head on the windshield, especially if they are not wearing a seatbelt, causing head and neck injuries. In addition, the patient may strike the chest and abdomen on the steering wheel, causing chest or breathing problems and internal organ injuries. In the second pattern, the patient's body follows a pathway down and under the steering wheel, typically striking the knees on the dash, causing knee, leg, and hip injuries. Clues such as a deployed airbag may lead you to suspect certain types of injuries. Clues from a damaged windshield might also lead you to suspected certain types of injuries. So, rear end collisions. These are common causes of neck and head injuries. The law of inertia states not only that the body in motion will remain in motion unless acted on by an outside force, but also that the body at rest will remain at rest unless acted on by an outside force, such as being pushed or jerked. This explains why neck injuries are common in rear-end collisions. The head still remains as the body is pushed violently forward by the seat back, jerking the neck backwards if a headrest was not properly placed, and then it goes back forward. Next is a side impact collision, broadside or also called a T-bone. So these collisions have other injury patterns. The head tends to remain still as the body is pushed laterally, causing the injuries to the neck. The head and chest, abdomen, pelvis, thighs may also be struck directly, causing the skeletal and internal injuries. Many vehicles are now equipped with those side impact or side curtain airbags, which are designed to protect the occupants from the side impact collisions. And next is the rollover collisions. These can be the most serious because of the potential for multi-impacts. The rollover collisions frequently cause ejection from anyone who is not wearing a seatbelt, except any type of injury pattern, or you want to expect any type of injury pattern with these. So here's an example of a rear impact. Here's an example of a side impact. And here's an example of a rollover collision. Then we have the rotational impact collisions. These involve cars that are struck and then spin. The initial impact often causes subsequent impacts. So the spinning of the vehicle strikes another vehicle or possibly a tree, as in a rollover collision. And this can cause a multi-pattern injury. So it can be an important aspect, actually, of the mechanism of injury in determination is to find out where the patient was sitting in the vehicle, and if a lap or shoulder belt were used, and whether the airbags actually deployed. And then you want to note any deformities in the steering wheel, the dash, the pedals, or other structures within that vehicle. You will often be able to observe these clues regarding the mechanism of injury before you even exit the ambulance. So you're always looking ahead when you are going up to a scene. Falls are another one, and it's another cause of injury where the extent and pattern of the damage may be determined by characteristics of the actual fall. So important factors to consider are the height from which the patient fell, the surface the patient fell onto, the part of the patient that hit the surface, and then anything that interrupted that fall. So in falls, injury to the part of the body that comes in contact with the ground or other hard surface is only the beginning of the trauma experienced by the patient. The force is also transmitted to adjoining parts of the body. So for example, think about a person who dives into a shallow body of water and strikes their head. Although their head will be injured, the force still travels onto the cervical and the thoracic spine and is very possible resulting in severe spinal injury and paralysis. So similarly, when a patient jumps from a height and lands squarely on one or both feet, there is trauma to the feet, but also to the ankles, the legs, and even the pelvis. So always assess along the path of the energy, and it is likely that you will find additional injuries. So we always tell people when you have a traumatic injury of any sort, you should always be taking off their clothes. You should be cutting away their clothes so you can see the entire injury pattern. Okay? So right now, the general guideline from the Department of Health and the Health Services, the CDC and prevention, is that a fall that's greater than 20 feet for an adult or greater than 10 feet for a child under the age of 15 or more than 2 to 3 times the child's height is considered to be a severe fall to which transport to a trauma center is recommended. So just keep that in mind. Here's the characteristics of a fall that may provide valuable clues to a patient's injuries. Don't get caught up though on that. You also have to consider that there may have been a medical emergency that caused this fall. So even though it looks like it was a fall and whatever else, if they're unresponsive or don't remember what happened, you need to be looking a little bit farther into it than just saying, oh, they fell. It could have been a cardiac issue, it could have been a stroke, it could have been diabetic, whatever else, but you need to determine that. Some important factors to figure in when you're talking about falls is the height from which the patient fell, the surface, the part of the patient that hit the surface, and then anything that interrupted that fall. And we kind of discussed this already, but it's just always a good thing to remember that these are the important factors with a fall victim. All right, then you have your penetrating trauma, which is injuries that are caused by an object that passes through the skin or other body tissues, and it is classified by the velocity of the item that caused the injury. All right, so you have low velocity or what we consider knife injuries. Damage is limited to typically the penetrated area, but may be multiple wounds. Then you have the medium velocity or a handgun or a high velocity, which is the rifle, injuries that may be anywhere in the body. So damage directly from the projectile can actually be a big issue, and pressure related damage or cavitation. Blunt force trauma is an injury caused by a blow that strikes the body but does not penetrate the skin or other body tissues. So signs are often subtle and easily overlooked. They want to maintain an index of suspicion based on that mechanism of injury. Nature of the illness. So the reason the patient called EMS, okay, that is the nature of the illness. To begin to identify the nature of the patient's illness during the scene size up, you must scan the entire scene. You want to actively look for any additional patients such as pedestrians or cyclists. Information may be obtained from many sources. It could be the patient, the family members or bystanders, and it could be from the scene itself. So don't get tunnel vision and look around. If you don't get in the habit of looking around from the very beginning, you're going to get injured. So don't be naive out there. Number of patients and adequacy of the resources. So here's some questions to ask. How many patients are present? And do I have sufficient resources on hand to care for all these patients? If not, get on the phone, get on the radio, and call for additional help. You want to try to anticipate the maximum number of patients and radio for the help accordingly. And then again, following your local protocols. All right, that was a quick chapter, simple chapter, but let's do a quick chapter review. Scene size up is the first part of the patient assessment process. It is important during the scene size up to determine what, if any, threats there may be to you and your own safety or to the safety of others at the scene, and then take the appropriate standard precautions. Next, it is important to determine the nature of the call by identifying the mechanism of injury or the nature of the patient's illness. Finally, you must take into account the number of patients and other factors at the scene to determine if you will need additional help. Remember, determine what, if any, threats there may be to your own safety and to the safety of others at the scene. Take appropriate standard precautions. Determine the nature of the call by identifying the mechanism of injury or nature of the patient's illness. Determine the number of patients and any additional resources that are necessary. Questions to consider. For each of these dangers, what action must be taken to remain safe at a collision scene? What if you have leaking gasoline? What if you have toxic or hazardous material spill? What if you have a vehicle on fire? Or what if you have down powered lines? What are common mechanism of injury patterns for the following situations? Head-on collisions, rear-end collisions, and a fall from a height. Critical thinking. You are called to the scene of a shooting at a fast food restaurant. En route, you plan your scene size-up strategy. What actions do you anticipate taking on arrival?